Hey everybody, I am here with Dr. David J. Levens at David J. Levens Plastic Surgery. You can find him at drlevens.com. So we're here to talk about cosmetic surgery and some of the procedures that he does there at his practice. So Dr. Levens, thanks so much for joining us today. I wanted to just start off by asking how long you've been working as a plastic surgeon.
A very long time. No, it's 33 years.
Awesome.
I started in 1989.
Okay, awesome. Was there anything in particular that drew you towards that, made you want to work with those patients?
Well, in medical school, I was definitely gravitating towards surgery. You kind of, during your fourth year, you do different rotations to see if you like a medical field, a surgical field, cardiology, whatnot. And I kind of gravitated toward the surgical fields. I spent some time in orthopedics and in urology, general surgery. And then I did a elective in plastic surgery with a very colorful plastic surgeon at my medical school, which is at Columbia in New York. And I really enjoyed watching him and seeing what he did and all the different types of procedures he did. And that kind of inspired me to pursue plastic surgery.
Yeah, that definitely makes sense. Did you find that the, artistic aspect of it was something that, drew you towards
Well,
it?
so what appealed to me were a lot of things appealed to me. One was that there's definitely some artistic involvement. It's aesthetic, but it's also reconstructive, and it's operating on all parts of the body, and it's young and old. We all go through training in the beginning as a board certified plastic surgeon in reconstructive surgery. And a lot of the principles that we use in reconstruction, we have to apply to cosmetic or aesthetic. The public largely sometimes just thinks that that's all we do is cosmetic surgery. I frankly have changed my practice to doing mostly cosmetic these days, but everyone kind of grows up on the reconstructive procedures. And you find that patients are extremely satisfied and extremely, extremely grateful for a reconstructive procedure when they present to you with a bad deformity, an injury, a cancer that you treat,
Sure.
and they're extremely grateful. Cosmetic patients are grateful as well, but it's a whole different set of, they don't need to have the procedure. So you have to be very cautious about expectations and making sure to explain everything in detail.
Yeah, absolutely. That's a great point. And I wanted to find out with you with the, pandemic, the lockdowns and everything, what was your experience as far as, having to shut down? And then did you guys see a real, increase in patients coming back in once those are lifted?
Yes, our experience was very similar to a lot of my colleagues around the country. And we were closed for about 6 weeks from the end of March to May of 2020. And we reopened, and we had about 12 patients that already were scheduled for that period of time. And we thought that we might lose some of them, and 11 of them decided to proceed. One was just a little bit anxious financially, and because of COVID, we were doing a lot of testing, and we were able to open up after about 6 weeks, and the volume absolutely did increase. I have some theories, and people have come up with different theories about why that is, but it definitely was not a bad effect. It was a positive effect on volume and business.
Yeah, definitely. And so what are some of the main procedures that you perform at your practice? It looks like you guys do, pretty much the full gamut of plastic surgery, but what are some of the really common ones that you see?
Generally speaking, yes, I really focus a lot on breast surgery, and that involves breast implants or breast augmentation, breast lift, and breast reduction. And then it used to be more breast reconstruction. I'm not really doing that for cancer anymore. And implant replacement as needed, breast implant revision for a problem with the implants not sitting right or capsular contracture. And then more recently, breast removal or explantation has definitely become much more common, largely fed by, I think, a very vocal, minority of women that have breast implants, but they're the ones that get onto social media, and there's a very vocal group that contends that implants could be ruining their life in some way, and so-called breast implant associated illness. There's a whole list of everything from brain fog to hair loss to chronic fatigue. And it's hard to prove that, but the good news is that if there's a patient that's reasonable and they have those complaints and it makes sense to remove their breast implants, they do usually feel better. But that's the minority of all patients with breast implants, but they are a vocal minority, and they're and they're definitely more lately.
Sure, definitely. Yeah, it seems like it's hard to tell if that's, a particular patient and how they're reacting to it, or, what the cause of that really might be at this point.
Correct.
Mhm. And so for, the patients that end up having them removed, do you end up doing anything else to augment the breast, or are they just
So it
completely?
really depends. The best scenario is when someone has a reasonable amount of native breast tissue.
Mhm.
And then sometimes if they're not that droopy or saggy, you remove the implant, you remove the capsule to the extent that it needs to be removed. There's also a lot of talk about a total capsulectomy and en bloc capsulectomy. The capsule is the scar tissue that forms around the implant. It's the body's normal reaction to a foreign body. And it can be very thin and flimsy, or it can be very thick and calcified. And the unhealthy, sicker looking capsules tend to be the patients that have the symptoms, although sometimes they can have very normal looking capsules. The treatment is to remove the implant and then remove the capsule as well, because there can be some contamination in the capsule. There are people that talk about, I have to have an en bloc capsulectomy, which sounds more like a cancer operation, but
Mhm.
sometimes it's a description of going beyond the capsule into normal tissue, and you have to be cautious about overdoing it and creating possibly deformities
Mhm.
or getting into the chest cavity. But anyway, a patient with some reasonable amount of breast volume, you can shape them either without any lifting or possibly a breast lift.
Mhm.
And they can end up with a very nice result. And as I said, generally speaking, tolerant of perhaps not the most ideal looking breast, because they're happy to have the implant removed.
Sure,
The
definitely.
other option is fat grafting.
Mm.
So fat grafting is something that can be done primarily at the same time, or it could be done as a secondary procedure if someone has concerns about contour areas. Then the fat doesn't actually go into the space where the implant was. It has to go into living tissue. So that's into the subcutaneous or fatty plane
Mm.
between the skin and the breast tissue. And that's the space where the fat has to go. So it can be challenging to get a good amount in at the same time, and therefore a secondary fat grafting is more common.
Okay, and so that's an option for patients that might have those symptoms and are thinking about, getting removed.
And are quite small. And if they're quite small breasted and they also have an equal concern about any possible deformity or what is their breast going to look like afterwards, which they may be plagued by the potential breast implant illness, and then they're plagued by the possibility of a deformity
Mhm.
removing the breast implant.
Definitely. What do you usually use to determine, if you're going to do an implant or the fat grafting, when you're doing a primary breast aug?
Um, Well, when I see a patient, you're talking about for primary breast
Yeah.
augmentation. So for primary breast augmentation, fat grafting is much, much less common than implants, because
Mhm.
implants are really the simplest, most straightforward, largely
Mhm.
safe option for augmenting a breast. I'd say probably only 5% or less of primary augmentations are done with fat only, because you only can get so much volume in there. So whether you can add, say, 150 or 200 cc's of fat, the
Mhm.
average implant is about 300 or 400, and
Mhm.
so you can't get them that big. So then there's the possibility of doing a secondary fat grafting. But primary breast augmentation is still largely with implants.
Okay. And the nice thing about the field of plastic surgery is it seems that, anytime a problem like that comes up where patients are experiencing those kind of symptoms, it seems that, somebody takes the initiative to develop, maybe an implant that doesn't cause that, or maybe there'll be some advancements in that area as well.
Well, actually, yes, I would have to say that plastic surgeons are quite innovative,
Mhm.
and we kind of are constantly evolving and changing and thinking. And it's a small group. I think there are only about 6,000 or 7,000 board certified plastic surgeons in the country,
Mhm.
but always going to meetings and online education to learn from our colleagues about different innovations. And like a tissue expander was invented by plastic surgeons, and microsurgery, and it actually, that microsurgery and grafting, I mean, that came out of kidney transplant, but there are a lot of innovations, yes.
Yeah, absolutely. It's incredible to see, how far the field has come, even just since like the 80s, 90s, and up to now, all the different procedures and different techniques being used to help, reduce downtime and everything.
Correct. And then a big shift towards minimally or less invasive.
Mhm.
As a surgeon, I mean, my main focus is doing surgical procedures, but I
Mhm.
also do injections. So I do injections of Botox and fillers, and we have a med spa and my esthetician does laser treatments and chemical peels and some radio frequency treatments. So not everything needs to be a surgical fix. Generally, for younger patients, for facial rejuvenation, it's okay to proceed with injectables. And then as someone gets to be 50s or 60s, it's time for more of a surgical fix like a facelift or blepharoplasty, eyelid surgery.
Yeah, definitely. Do you find that some patients will do both of them together, have a procedure and then do some of those minimally invasive ones in conjunction?
Yes, that's an important point because, for example, I just had a patient today for consultation that wanted to have her eyelids done. And then she said, because she's got some droopiness, and she said, well, is it going to take care of the crow's feet and the crepey skin underneath? I said, no, you need something else for that. So that would be, for example, a chemical peel or a laser treatment to treat the skin surface. It's kind of like you can pull the skin up, but you have to still smooth out the surface. So it is common to combine surgical and non-surgical either at the same time or adjunctively in stages. That's not unusual at all. It's pretty common.
Definitely. And then have you guys implemented anything into the practice in the way of, helping patients reduce their downtime with, anesthesia or anything like that?
Yes, for sure. It's the 33 years, so probably 15 or so years ago, I stopped doing tummy tucks in the hospital. Tummy tuck procedure, abdominoplasty was always an overnight stay in the hospital. And now the last 10 or 15 years, we've been doing it outpatient. And the reason is because we have a product called Exparel, which is one treatment. It's an injection of a long-acting anesthetic that's injected into the tissues. It definitely helps to cut down on pain. And there used to be just more narcotics or a pain pump, which is an external device. So this way we encourage people to get up quicker and decrease chance of blood clots, and they're healthier, physically healthier, mentally healthier, they feel better. And so things have definitely evolved. There's no question that used to be, then again, things like bowel preps, people used to be in the hospital for a few days. So it's kind of like a financial problem, and then the realization that it's not necessary to do those things. So there definitely been a move to less and less hospitalization, less and less lengthy recovery. The average recovery with a tummy tuck is about 2 weeks initial downtime, and then up to 6 weeks before you can be very vigorous. Breast augmentation, just a few days. And then if you want to do really vigorous chest exercise, I recommend waiting about 4 weeks.
Okay. Yeah, that makes sense. And, I wanted to find out from you, what do you typically look for with patients as far as, their physical health, and also kind of where their mindset is at as far as, expectations for these procedures?
Well, the way I look at it, this is purely elective surgery. It's cosmetic surgery. Patients don't need to have this surgery. And therefore, I'm very risk averse, and I think patients should be risk averse. And right away, when someone comes into the office, I'm assessing their mental status, their physical status, and they might think they're ready to jump on the table the next day. And I really don't want to operate on them because I don't want to take the chance that they're not going to do well mentally or physically. So there's a lot of screening that goes on with patients preoperatively in consultation. And it's kind of interesting because sometimes patients get upset, like, oh, you're not going to operate on me. And the truth is, I'm not. I know some people may jump in sooner. I'm a little bit more hesitant, cautious about that. I think it's the way to be, because safety is number one. And selfishly, I want to make sure that my patients are happy with the results. So they have to have realistic expectation.
Yeah, definitely. I think if there's anybody that you want to be overly cautious and, a bit of a perfectionist, it's definitely your plastic surgeon.
Yes.
Definitely. And, I think, thankfully there's been less of a push of patients going to, like South America and places like that to have procedures done. But can you speak to a little bit of the importance about seeing a board certified plastic surgeon?
Sure. Well, the truth is that there are board certified plastic surgeons in other countries, like South America, and I'm here in South Florida. So many of my patients are patients that I've heard about go to Colombia, they go to Dominican Republic. And the truth is, I say that they could get a very good result there. They might find a very good surgeon there. The main problem has to do with follow-up. And so I follow my patients closely. I stay in touch with them with a secure texting app where I can check on them at night, and they're in touch with me 24/7. It gives a great degree of comfort for them and for me to know everything's going well and making sure they have their instruction. And if you go overseas to have your surgery, whether it's a week or two and you recover, what happens for the next few weeks? And then what happens if you do have a problem or an issue and you're concerned about it, will another doctor take over? So that's what I think, that it's appealing to people because it seems like it's very inexpensive. I don't even know if they have malpractice insurance down there. They just charge very little. It's incredible how little some of the fees are.
Yeah.
But there's definitely the issue of aftercare, which is very important. Aftercare and safety, and making sure that someone can still be around to take care of them for several weeks after the surgery.
Yeah, definitely. And, like you said, it is still surgery. So, complications are possible.
Correct.
And, if you have a complication and you have to go see another doctor, you might end up, losing any money that you might have saved by doing that.
That's exactly right. That's exactly right. And any plastic surgeon that operates on board certified plastic surgeon has to have hospital privileges, even if they operate in their office or an outpatient surgery center, because if someone does have a complication and they have to be hospitalized, for example, they have to be tended to in the hospital. And so occasionally, you hear stories about people that end up in the hospital, like, where's their doctor? Well, he's in another country, or he doesn't have privileges because he may not be a board certified plastic surgeon. So that's the whole cosmetic surgery versus plastic surgery. Plastic surgery includes reconstructive and cosmetic. Cosmetic can be just cosmetic, and there are cosmetic surgeons that don't go through the entire training, 5 or 7 or 8 year training of a board certified plastic surgeon. So they're not really necessarily able to or desiring to take care of problems that may arise.
Yeah, definitely. And so if somebody goes to the hospital and they don't have their, surgeon there, are they basically just, being taken care of by, another
Well,
doctor?
it could be a general surgeon or an internist, or trying to do their best. And then they try to encourage, it's been a while, but they try to encourage myself or another plastic surgeon on staff to come in and at least give an opinion and help the patient out if they need to in a desperate situation. They have an infection or they're bleeding, and got to take care of the patient first and worry about everything else later. But it just becomes a bit of a quagmire.
Yeah, definitely. And then lastly, what would be your, advice to a patient that's maybe not sure how to find, a surgeon in their area and is kind of just, still trying to get educated on what they should look for?
Well, there are a million resources online, and like we always say, you have to do your homework, and people know how to look things up online. They may not be able to decipher what's legitimate, what's not legitimate, so you have to dig a little bit deeper. But the American Board of Plastic Surgery, the American Society for Plastic Surgeons, the American Society for Aesthetic Plastic Surgeons, those are 3 good places to start. And there are lists of local doctors. Then the other thing is just kind of word of mouth from patients, from friends, family, and then from your own general doctor. Who do you respect, who's been around for a while and is really good? And then once they hone in on a couple names, reviews are a very popular and good way for people to evaluate. If someone's got a bunch of terrible reviews, you probably shouldn't be going there. And if someone has a lot of good reviews, then that's a good sign. If they're all 5s, it may not be a great sign because maybe they look fake, but somewhere in the 4s and higher is always good. And we certainly encourage people to review us. And one of the things that I hear people say is, "Oh, you have such great reviews." I say, I hope you'll become the next one with a great review, and you'll have a great result, and be willing to share that. That's how you build maintain your practice with current patients, and then they spin off friends or family members, and then a secondary procedure. If someone comes in for breast augmentation later, they want to have a tummy tuck or something of that nature.
Yeah, definitely. And I think that goes back to what you said about, being, careful who you pick as a patient, who's going to be a good fit, who you can get a good result for.
Exactly.
Really. And then what would be the best way for patients to get in contact with you?
Well, our website is drlevens.com, drlevens.com. I have 2 main Instagram pages. One is Dr. David J. Levens, and one is Plastic Surgery Talks. And then our phone number is 954-752-1020. We're in Coral Springs, Florida. It's about an hour north of Miami, about 20 minutes from Fort Lauderdale. I've been here for 33 years. We have a small office with about 4 employees, an esthetician. The operating room we use is a colleague's. So lately I've been using a colleague's office operating room. where we share the space, the nurses and the anesthesia staff. It's fully accredited, and it's a very nice, cozy, safe place for surgery.
Yeah, that's fantastic to hear. All right, perfect. Well, those were the questions I had for you today. So I really appreciate you taking the time to talk with us and share the education. That was great.
You're very welcome. Thank you very much for interviewing me.
Yeah, absolutely. Have a great rest of your day, Dr. Levens.
Okay, you too, Bill.